Hepatitis C. Hepatitis C, it is another form of hepatitis, which is caused by hepatitis C virus, which is one of the hepatotropic virus. Once the virus enters in the body, it will not replicate except inside the liver cell. But unfortunately, hepatitis C virus, it is a little bit more dangerous than the hepatitis A and hepatitis E, because it circulates in the virus is present in large amount in the blood. The virus is always characterized by the chronicity. Hepatitis A, there is no chronicity. They are always diagnosed accidentally, because the amount of the viral load of hepatitis C in the blood is a little bit lower, so it cannot be detected easily. Most of the cases of hepatitis C virus, they were diagnosed accidentally during a routine work, or before attending an operation, or before or during screening and so on. So hepatitis C virus, it is almost associated with chronic liver disease or chronic hepatitis, and chronic hepatitis may always lead to hepatocellular carcinoma, as the same as hepatitis B. Hepatitis C virus, so it is a highly contagious liver disease that results from the infection with this virus. It is the most common virus to infect the liver, and it has been shown to be a major cause of parenterally transmitted hepatitis and one of the major causes of hepatocellular carcinoma, as I had mentioned, because they are always associated with chronic hepatitis. The cycle of infection of hepatitis C. Hepatitis C virus is classified belonging to the family Flaviviridae, genus Hepacivirus. The variant is enveloped, the others were non-enveloped. The variant is enveloped with an icosahedral nuclear capsid containing a genome of a single-stranded positive sense RNA. Here you can see this is a hepatitis C virus structure, single-stranded RNA. Okay, it is an enveloped virus. Okay, it is a fatty liver. Any enveloped virus, it is resistant, more resistant than the non-enveloped viruses. The genomic diversity, hepatitis C virus displays a diversity in the RNA genome due to the high rates of mutation in the virus. The virus undergo different mutations, and we have different serotypes. They are about from 1 to 7 genotypes. It is classified into 7 confirmed genotypes, genotype 1, 2, 3, 4, 5, 6, and 7, and many subtypes based on the difference in the genes that encodes for the enveloped glycoprotein. So the presence of different genotypes, this will lead to more infections all over the world and more infections in the community. The genetic diversity is not correlated with the difference in the clinical picture. Clinically, if I'm infected with genotype 1 or with genotype 2 or with genotype 3 or with genotype 7, the clinical picture is exactly the same. Okay? The clinical picture in different genotypes are exactly the same. Although there is differences in the response to treatment. For example, the using of the pegylated interferon and ribavirin is specific for the genotype 4. It might not be specific, or it might not be of a great benefit in genotype 6 or genotype 7. That's why the genotype is very important for the treatment. The different genotypes are responding to different treatment. Different genotypes predominate in different parts of the world. Genotype 4A, it is the most common genotype in Egypt. So genotype 4A, it is the most common genotype of hepatitis C virus infection in Egypt. The clinical and the virological, serological events associated with hepatitis C. Hepatitis C virus, we do not concentrate with the antigen. We are concentrating with the antibody. The presence of the antibodies of hepatitis C virus is indicative of infection and indicative of recovery and indicative of chronicity. So the presence of the antibodies of hepatitis C virus does not differentiate or does not distinguish between whether this is an acute illness or post-infection or a stage of recovery, which is a very bad sign. It is very difficult to diagnose. The average time from the exposure to the appearance of hepatitis C virus is from 8 to 9 weeks, meaning that if the patient is infected parenterally through blood transfusion or blood products or by injection to hepatitis C virus, he will develop hepatitis C virus within 8 to 9 weeks. And when he developed the hepatitis C virus infection, it will be diagnosed by the presence of the anti-hepatitis C virus. Most patients, 90%, undergo seroconversion within 5 months. I mean, seroconversion means they are infected and the antibodies will start to appear. The serum hepatitis C virus RNA can be detected within 1 to 3 weeks after the exposure. So in the serum, I'm only looking for the antibodies. But if I am looking for the RNA by the PCR, after 1 to 3 weeks after the exposure, I can detect the hepatitis C virus RNA. RNA testing, therefore, remains the only means of diagnosis of seronegative patient. Meaning that if my patient comes to me and he said, I am transfused with blood from an infected, other infected patient, which I am sure that he has hepatitis C, I will tell him, okay, I will make ELISA and I will see if he has antibodies. He will not show me any presence of antibodies against hepatitis C virus. He is a negative. But I cannot tell this patient, you are completely recovered. I have to wait for at least 1 to 3 weeks, or after 1 week or after 2 weeks, and I have to look for the serum hepatitis C virus RNA by the polymerase chain reaction. Or after 2 months, I can make another ELISA technique. I might find the seroconversion or the presence of positive antibodies. In acute self-limiting infection, the antibodies against hepatitis C virus decline in the titer. In acute self-limiting infection, resolution is diagnosed by the continual absence of viremia with normal serum ALT. No any viremia, no any virus circulating in the blood. The viral load is 0 level, and the liver enzyme is completely normal. In this point, I can say my patient have been recovered or undergo resolution. So again, the serum hepatitis C virus RNA, which can be detected by the polymerase chain reaction, can be detected within 1 to 3 weeks of exposure. RNA testing remains the method of choice for the diagnosis of seronegative. Seronegative meaning that the antibodies are negative. In acute self-limiting infection, the antibodies against hepatitis C virus start to decline in titer. The resolution is diagnosed by continued absence of viremia. Viremia means absence of the virus in the blood, and the normal level of ALT. In chronic hepatitis C virus infection, the serum ALT concentration may fluctuate. The liver enzymes are fluctuating over time and even may be intermittently normal. Hepatitis C virus RNA can persist for life. The patient may undergo complete recovery within 3 to 6 months, as I had mentioned, or he may remain chronically infected with hepatitis C virus infection for decades. Here in this curve, you can see the hepatitis C virus RNA, which can be detected by the polymerase chain reaction, are seen during the incubation period, 1 to 2 weeks after illness, and it remains for life if the patient will not undergo recovery. The antibodies against hepatitis C virus is low, and then it starts to be elevated, but it never declines. It might remain for life. The liver enzyme, as you can see here, which the yellow line, this liver enzyme is elevated during the acute illness, start to subside, and then it also elevated from time to time. It is fluctuating. Okay.